It's to even out the Monday, Wednesday. It's to even out, because Columbus Day is on Monday. You know we have class on Monday. Yes? So our like Columbus Day break that normally would have been Saturday, Sunday, and Monday is now Thursday, Friday, and Saturday. That's to even out because there's so many Monday holidays in our schedule. The people that met on Mondays and Wednesdays for their classes were sort of getting ripped off as far as meeting. So we decided to change it up and do this. So you will have classes on Monday. Monday is not a holiday for you.
But if you have no classes on Monday,
Then you're all set because you don't have classes on Monday. Huh? Do you have to go to work? I don't know. If your job says you have to go to work, yes, you have to go to work. So we're talking about joints today, and a joint is what? It's where two bones, give me science speak. Two, not connect. Articulate, that's the word I want. So we classify joints in several different ways. First of all, we classify them by function. What goes on at that joint? What goes on at that meeting? So the functional classification terms that you need to know, and you're going to see this is sort of like a little vocabulary section for you. Some of these words sort of mean the same thing. You'll see that in a minute. So synarthrosis, what's that mean? Immovable joint. Give me an example of a synarthrosis. Yeah, we don't want these shifting around up here, yes, in the skull? So what's an example of a synarthrosis? Give me science speak. A suture, yes? So a suture is an example of a synarthrosis. Amphiarthrosis, slightly movable. Has anybody ever had children? We have a very important slightly movable joint, an amphiarthrosis, in our pelvic region. It's where our two pubic bones meet. Yeah, it's called the pubic symphysis. We want a little bit of movement there. Not a lot, because we don't want to dislocate our entire hip. But when it comes to childbirth, we want a little movement. That's a good example of what we call an amphiarthrosis, slightly movable. And then we have these guys. There's all kinds of stuff going on. And what do we call that? That's a diarthrosis. That's a freely moving joint. Most of our diarthroses are what? It's a special kind of joint. It's called a synovial joint, exactly. So a lot of them are synovial joints, diarthrosis. So that is classification by what? Function. Now, these different joints might fall into one of those three categories, depending on what's going on there. So we have fibrous joints. And what are fibrous joints? Joints that are connected by what? Connected by what? Fibrous what? Connective tissue. Yes? Okay. So fibrous joints, we have sutures. Examples here in this diagram on page 250, figure 8.1 in your textbook. So sutures can also be called what? Synarthrosis. You see where we're going with that? Sutures are what kind of joints, what kind of material? Fibrous joints. Yes? So it's one of those things where the words kind of intertwine. So when sutures start to close up, synostosis, to form a bony junction. Remember when we looked at the skull way back when in chapter, whatever it was, end of chapter 7? We saw all that membranous material between the bones and the skull of our developing fetus. That's where this term is used. Then we have something called the syndesmosis. And see, we see the sin again. Sin. Sin kind of refers to what? Something that's not doing a whole heck of a lot of moving. Yes? What's a syndesmosis? Yeah, held together again by that fibrous tissue ligament. Remember when I gave you that little example of the fact that your ankle doesn't move like your wrist does in the last class? One of the reasons is the syndesmosis between the distal aspect of the fibula and the tibia. Yes? Is that lateral or medial? Say it out loud. Lateral. Yes? Because where's the fibula? Is it lateral or medial? Lateral. Yes? So see it down there, that little ligament? That's a syndesmosis. Then we have another one that doesn't do a whole lot of moving. It's called the gomphosis. Sometimes you see it referred to as a peg in a socket joint. And that's where what meets what? Do your teeth move a whole heck of a lot? They can, though. Anybody ever had braces? We can move them a little bit. But we don't want them to move a lot, because what's going to happen? They'll jiggle too much and fall out. So we have fibrous material, the periodontal ligament, that holds teeth in their gomphosis. That's their joint name. Where do you have gomphosis? Which bones in your skull? The maxilla and the mandible. So those are kind of questions you're going to see on, because they're going to make you think about where this bone is. Yes?
Gomphosis is only mandible, maxilla, and suture is only in your skull.
Pretty much. And there are some, examples of what we might define as sutures in other places, like epiphyseal plate, which then becomes an epiphyseal line. Yes? Yeah, different tightly fibered bones. That's the best example. So, suture, syndesmosis, gomphosis. Understand how the terms kind of work together with respect to functional classification and fibrous joint classification. Have I lost you yet? Yes? Did you read the chapter? You did, and you're still lost. No. No, not you. I'm behind you. She's like, I'm not lost. I really am not. No. What you have to do is kind of sit down with this and put the terms side by side. What might happen, what you might do is, did you ever create one of those little vocabulary lists when you were younger, where you take the word and you put it here and you fold the paper into like thirds? Well, maybe if you do something like that, then you'll see how they all sort of meet together. Hope that help? Try something like that. Okay, so those are the fibrous joints. Then we have cartilaginous joints. And guess what we're going to find between the two bones that articulate? Cartilage, exactly. The epiphyseal plate. And do you have any epiphyseal plates? No, because you're too darn old. What do you have now? You have epiphyseal lines. But the epiphyseal plate, kind of a temporary place where bone grows in what? Length, exactly. So we see these cartilaginous joints. Synchondrosis. What's a synchondrosis? Sin again, sin. It's not moving too much, yes? So we don't want epiphyseal plates to move too much, do we? Because what's going to happen if they do? We want to pop the top of your bone off. That's not good, right? What else? We see another synchondrosis where? The sternum, that big flat bone in the front. And the joint between the first ribs. Very, very tight, immovable. It's sort of the stationary point. When I breathe in, it's kind of like opening an umbrella. My thoracic cavity opens this way and this way. But up here, not a lot of movement at that first set of ribs. So that's a nice, tight, stationary point. A very good point. It does help to protect a lot of the main arteries that run up your neck to feed your brain. So yeah, that's a dual purpose. So that's a synchondrosis, chondrocytes. You see the connection between the word and what it is? What's a chondrocyte? It's a cartilage, it's cells that maintain cartilage, right? So a synchondrosis is a cartilaginous joint that doesn't do a lot of what? Moving. Yes? So if you understand the terminology here, and that's why I say this is sort of like a vocabulary grouping. If you can read the word and understand the little parts of it, it's easy. Yes? Symphysis. And we talked a little bit about that. What kind of, if I ask you what a symphysis is and ask you to define it based on its classification, functional classification, what would you call it? There's 3 words for functional classification, right? What would a symphysis be? A slightly movable. Give me the science term. Amphiarthrosis. Yes? So this is also a cartilaginous joint because what's the material between the 2 bones? Cartilage. But it is also considered, based on its functional classification, a amphiarthrosis. Yes? So a symphysis. We find fibrocartilaginous material in the intervertebral disc. So we have slight movement there. We don't want a lot of movement, though, because if we did have a lot of movement, what would happen to all the spinal nerves that are feeding into the spinal cord? Yeah, they'd get crushed or broken or frayed, which probably wouldn't be very good, right? You'd lose that connection. So fibrocartilaginous intervertebral discs, also in this category. So what else could I functionally classify an intervertebral disc as? Amphiarthrosis, that middle word. Yes? Take a deep breath. Remember, it's a vocabulary list. So who do we have next? So we have, synchondrosis, symphysis. Who do we have next? Synovial joints. So here again, in the cartilaginous joint category, we see cartilage associated with these joints. This is freely moving joints. Now when I have all this movement going on, just like in our engine, when our pistons go up and down in the engine block, what would be helpful there? Some fluid, yes? To do what? Reduce the friction of the movement that's going to go on in those joints. So synovial joints are functionally classified as what? The diarthrosis, which is a freely moving joint. Another thing we have to remember about the synovial joint is its parts. So we usually have 2 bones that articulate and meet. And what are they covered with? What kind of cartilage? Articular cartilage. That makes sense, right? That particular type of cartilage, in most cases, is hyaline cartilage. Remember when we looked at it under the microscope? It looked like a skating rink with little holes for the cells. Nice and what? Smooth, slick, slippery, so that the bones can slide across each other and not grind on each other. So we have articular cartilage, which happens to be hyaline cartilage. Then we usually have some sort of ligament that holds the 2 bones together. Because remember, that was the definition of a ligament, right? Ligament holds bone to bone. So we have ligaments that join to form the capsule of the synovial joint. There's a fibrous layer, and then there's a layer that actually makes the fluid that hangs out inside synovial joints. That's called the synovial membrane. Together, that little unit is called the articular capsule. So the capsule that it creates between two articulating bones. Remember, what's inside the articular capsule? Fluid. So synovial fluid is hanging out in this space. That space is called the cavity, because, we don't like to use the word space in science. So it's the joint cavity. And it contains what? Synovial fluid. Yes? So you should know the general structure of a synovial joint and all of its little parts and what they do for a living. Okay? You see table 8.1 on page 253 in your textbook, and that's going to give us a summary of joint classes. Another thing that's going to help with those freely moving joints, and that's why we still see it under synovial joints, because there's a lot of pressure and tension going on with all of this movement. We have little sacs. What can I equate them to? I don't know. Little sacs that help to decrease friction. So it's not just free fluid, but it's little sacs that are going to help decrease friction and pull and tension in any given joint as well. These little sacs are called bursa. We also have some that are wrapped around the ends of tendons. What's a tendon? It attaches muscle to bone, and muscle does what on bone to make it move? It pulls on it, so hence there's some tension there, yes? So bursa and tendon sheaths are little sacs, kind of like gel. Remember we talked last class about the little gel inserts in your shoes? The little Scholl's squishy gel and things? That's what these are like. And we're going to find them wrapped underneath or wrapped around, depending if they're a bursa or a tendon sheath. And we're going to and we're going to see them in joints that do a lot of movement. Anybody ever have bursitis? Me too. Something to look forward to when you get older. And what is bursitis? It kind of counteracts what it's supposed to do, because the little sac does what? It doesn't break, it inflames. And it creates pressure rather than reduces pressure and friction. And that can cause what? Pain. Yes. So we see these in major joints. Those shoulders, where else? Hips. Yeah, knees. So places that take a lot of pressure, a lot of tension, a lot of pull, some of our major synovial joint areas. So they're going to help us quite a bit. Now, don't get nervous, but you should recognize where in the body some of these major joints are. So this is why I don't want you to get nervous. I just want you to have a general understanding. So if I say skull joints, if I say something like temporomandibular joint, and I ask you where it is, you're not going to point to your knee, right? Where are you going to point? And it's simple, because why? Usually they're named for the bones that articulate. You know where the temporal bone is. You know where the mandible is. There you go. So these names, sternocostal. Where's that? Exactly. So the question I'm going to ask you on the exam is going to be just that general. I'm going to say, where is the acromioclavicular joint? And then you're going to have 4 choices: in the knee, in the head, in the thorax, in the shoulder. And you're going to pick? Shoulder. Good job. So that's what I want you to know. So it seems like lots of words, but do not panic. Where are you going to get that information? Table 8.2 on page 254 and 255 in your textbook. So basically this table. The other thing you have to know is some of the factors that influence the stability at synovial joints. Now again, we've talked about some synovial joints, and it's football season, so you've probably heard about a whole bunch of them. Some of the things that cause stability in joints. A few of our football players get knocked out for the season because they get hit in these stabilizers, or they mess up some of these articular surfaces, especially in the knees. That's what we're hearing a lot of because it's football season. And we don't even want to discuss Sunday. We'll erase that from our memory, yes? No, don't even talk about them. So anyways, it's a very depressing Sunday for me. Give me some of the terms you've heard football season. With respect to joints. ACL. What's an ACL? Anterior cruciate ligament. What's that doing for me? It's helping to stabilize who? That knee region. We're going to look at the knee joint in a minute. Woo! It's scary in there. But there's tons of different stabilizers in there. The articular surfaces are going to help stabilize those joints, keep them together, keep them moving the way they should. We also have ligaments that are going to help do that too. The more pressure, the more movement a joint, any given joint has, the more we're going to see of these stabilizers in place. And then muscle tone itself. When our muscles start to get untoned, I hate to use the word flabby, but okay, flabby, they're not going to be able to pull and stabilize joints properly. So muscle tone is very important for joint stability. Just have a general understanding of that. Here's the other part you're going to hate me for, more vocabulary for you to learn. The vocabulary you need to know is about movement at the synovial joints. Remember, I can have all kinds of movement. This movement is in a whole bunch of different planes. This movement is only here, like this, yes? So, all of the terms that you see in all of these diagrams with the lady in blue, you need to know. So we have gliding movements, we have angular movements, movement in different axes, and that's kind of a math thing. You know, when you have that little graph paper, and you can go in all kinds of different directions. Well, remember, we're in a what dimensional world? It's not just on the graph paper. What do we call that? Three-dimensional. So we can go behind the paper or in front of the paper, along with all the movements we can do in different directions in that dimension. Huh? Yeah. You can go under the paper. So, axial. And they talk about different axial movements. Uniaxial, in one axis. Biaxial would be what? In two. Multiaxial, it would be all around. So gliding movements, angular movements, flexion, extension, abduction, adduction, circumduction, rotation, special movements like supination, pronation, dorsiflexion, plantar flexion, inversion, eversion, protraction, retraction, elevation, depression, and opposition. Now, again, if you're a visual person like me, use the lady in the blue leotard to help you understand these terms. So they're starting on page 256, 257, 259. We see pictures of these movements. You need to know them by definition. Okay? And some of them hopefully are self-explanatory based on the terminology that you were supposed to know from chapter 1. I told you it would come back to haunt you. Yes? So there they all are. I can lecture you on them, but you can read and look at pictures just as good as I can. Yes? So we're good. By the way, what makes us so amazing? That. There it is, right there. That's why we're so awesome. Because we have what? Opposing thumbs. What kind of joint is that? Now we're going to talk about that. So there's different types of synovial joints, freely moving joints that can perform different actions. So here's more stuff for you to memorize from this chapter. Don't be so excited. Calm yourself down. So we can have planar joints, things that slide across each other. Where do we see those? Places like the, what are these little bones here called? Carpals, yes? They slide across each other. There's an example of a what kind of joint? A plane joint. What kind of axiom or axial movement is it? Non-axial movement. It kind of can only go like that. Yes? Can we do that? It's hard, yes? Then we have something called the hinge joint. When you open a normal door, of course, nowadays there's so many different crazy kinds of hinges, but think way back in the old days when you opened a door. Yes? It's uniaxial movement. Good example is that example I gave you of where the ulna articulates with the distal end of the what? The humerus. So that's an example of a hinge joint. Pivot, that awesome roll from one place to another that we discussed when we talked about who? The radius, the round head of the radius, and it can roll to the side of the ulna, allowing for that uniaxial pivot movement at a pivot joint. Who's that up there? And that's your metacarpals. Okay? And what kind of joint is that? It's a condylar. So it's like an oval shape ball and socket. I'm going to talk about ball and socket in a minute. That's like, whoa, that can do anything. Ball and socket joint. But when I make that meeting oval, I'm going to go biaxial instead of multiaxial. So I can't go in all different axes, but I can pretty much go pretty close. That's a condylar joint. This is our wonderful opposable thumb joint called a saddle joint, where the bones sit like this on each other so they can go back and forth to form the saddle joint. That's a biaxial movement. And then, of course, our ever so awesome ball and socket joints, where I can do just about anything and go in any direction for movement. Best place to look at those guys for us visual learners is on page 260 and 261 in your textbook, and that's basically what this diagram is. So plane joint, hinge joint, pivot joint, condylar joint, saddle joint, ball and socket joint. Know those terms, be able to recognize them in words. The book then goes on to select very specific synovial joints, basically because they're so gosh darn complex. Am I going to make you memorize those? No. But get an appreciation for football season, because look at that knee. It's crazy. Look at all the different ligaments and tendons and cushions of cartilage where bones articulate. Another very important sesamoid bone that helps reduce friction in the knees. Because remember, your knees are carrying all of you. The whole upright design, honestly, is not a good one. Because what's happening as we age? Gravity's push. Yeah, I lost my 1/4 of an inch that I've been hanging on to for all these years. I'm 5'5" and a quarter. Not anymore. I'm a straight 5'5" now. How come? Gravity. Yes?
I'm 5'5" now.
You're 5'5" now? Yeah. You're going to be shorter than I am in 20 years. Don't complain. All right.
5'1", and I'll just...
But it was so exciting when I could say 5'5" and a quarter. Now it's like, nope, not anymore, girl. So, sesamoid bones that kind of sit in big, long ligaments help to reduce friction in larger joints. So the patella, that's its purpose. It sits between ligaments that hold muscle, and these are your quadriceps muscle, quadriceps femoris to be exact, that patella, and then we have the patellar ligament which holds that muscle to where? What's this bone down here? It's the tibia. Watch what it allows us to do. Yes? Thank you. It's pretty good. So we get an appreciation for the complexity of the knee joint. When the tibia articulates with the what at the knee? The femur. We also see groups of heavy cartilage in the meniscus. So lateral, medial, depending on where it sits. Medial would be this way, lateral would be this side. And then we also have what we call the cruciate ligaments, and you can see them best here, that come on the inside underneath and help articulations. So these are all the supports I was talking about in the definitions earlier. We also see what else to help reduce friction? The little green sacs, bursa. So, very complex joints. Are we going to memorize them? No. But have an appreciation for them. No. No, 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 no. When you go on to kinesiology or physical therapy, if that's your poison of choice, yes. And that's going to be all yours to know and love, but not here in this class. Okay? So, hockey pucks to the knee are not good. Giant linebackers to the knee are also not good. Yes? Because they can break some of our supports. So we see the hockey puck to the knee, causing it to go in places that it shouldn't go. And you've probably seen some replays of some horrendous football injuries, which always make me cringe during football season. But when you break those supports, we have problems with movement of that lower leg. So this diagram gives us an appreciation for the pain in some of the common knee injuries. And you've probably heard them. Anterior cruciate ligaments. Poor Tommy got knocked out a few years ago for the whole season because of that nasty little injury. They take a long time to heal. How come? Yeah, you've got that constant pressure pulling on them. You've got gravity pulling on them. And ligaments are harder to heal than bones because of that pull, that constant pull. So, shoulder is another one they talk about. You should know them by name, and that's from the other table. So what was the knee joint called? It's called the knee joint. Just throwing that out there. What's the shoulder joint called? It's a ball and socket joint, but it has a special name. The glenohumeral joint. It's where the humerus meets the glenoid cavity of the scapula. So it's called the glenohumeral joint. So guess what kind of bone markings we're going to make you memorize? You're probably going to have to know where the glenoid cavity is on the scapula, yes? So we're picking things that are very common because they're associated with the names of some of these different joints when we pick those markings or landmarks on bones. Again, great appreciation for the complexity of this very complex joint, which contains lots of bursa and lots of ligaments that go in a whole bunch of different directions. And, of course, the wonderful articular cartilage that's going to prevent them from doing what to each other? They're grinding each other as they articulate with each other. Here we see a lot of tendon sheets wrapped around muscles that cause movement in those joints. Because see all the weird things I can do with that shoulder? That's why we have to have all these ligaments in so many different directions, not just a pull or push. And again, just like we have the meniscus in the knee, we see a large amount of cartilage in the glenoid cavity. Anybody ever have thank you, shoulder surgery before? You ever hear the term rotator cuff? And it has to do with all these different ligaments and tendons and meniscus and bursa. Who's this? The elbow joint. What do we call the elbow joint? The elbow joint. Very good. Again, taking a lot of pressure. It's nice when it's just called, what it's supposed to be called. Easy to memorize. But this is where what articulates with who? Humerus articulates with the ulna. Okay, and again, we see a lot of bursa and tendons in that region. So these are some examples of some of those amphiarthrosis ligaments that hold bone to bone, besides the one that they gave us an example of in the fibula. Fibula and tibia articulation. So we have a bunch in what? The hip, the knee, the glenohumeral. Anybody ever know anybody who's had a hip replacement before? Do they like take the whole hip out, and what are they doing? That ball and socket joint. So they actually, I used to have a great movie where they actually, with power tools, saw off the head of the humerus, and then they take this nice titanium thing with a spike in it, and what do they do to? Yep, they get a hammer, and they put it in there and bang it in. That's exactly how they're doing it.
That's what happens or sort of similar to when you get rods in your leg.
Well, they're screwing them in, actually.
Oh, yeah.
Yep. So that joint replacement involves skill saws and hammers. Exciting. They use what? Yep, DeWalt. So that is a hip replacement, knee replacement. It depends. We can do a whole bunch of different things, but we would replace joints in that region as well. What joint is this? Located in the skull. Temporomandibular joint. People who are a little on the tense side. Yeah, we ever hear of TMJ? What is that? Pain. It's ooh. I have to wear this obnoxious little plastic mouth guard at night. It's so attractive. And I put it in because I grind my teeth, and that can cause a lot of pressure and tension, and you just have this? Yeah, I bet you grind your teeth too. You don't? Okay. She would kill you. She would buy you one of those obnoxious things and put it in your mouth. Or she would steal one from work because she's a dentist. Yes? So the temporomandibular joint can cause some problems if it gets stretched out or tension is put on it. We see synovial membranes there as well. Even though it's little, there are synovial membranes there as well. So that's your issue, the side-to-side thing that caused the click-click. Do you click when you chew too? Oh yeah, see? I would have to throw something at you if I was having one. She drove you crazy with the noise. No, that's all right. I grew up with a sister who I couldn't eat anything that was crunchy around. No chips, no apples, no carrots. What's this? Yeah, this is when those stabilizers no longer stabilize because they have been broken down. So they talk about that under homeostatic imbalances of joints. So this is a arthroscopic photograph of a torn medial meniscus. Where's that? In your knee. We met that already. So cartilage tears can be a problem, especially in major articulating bones. So that rotator cuff or the meniscus in the knee are good examples. And these, again, are common injuries from too much wear and tear, too much pounding, or hockey pucks hitting you in the knee. That can cause problems with those supports. Cartilage also can tear. And again, cartilage, yeah, we just said that. I'm repeating myself. Sorry. So cartilage tears can be an issue. Sprain. What's a sprain? It's where those ligaments that are holding bone to bone might pull a little bit too much. So think of an elastic that can normally stretch and come back. When I pull it a little too much, say it doesn't quite snap, but say I pull it a little bit too much. It's not going to pull and come back nicely, and that's going to disrupt the support function it has. So when I sprain a ligament, it can lose its reinforcing function and can be a big problem. It can also lead to the next definition, which is something called a dislocation. So if I'm able to pull apart that joint more than I actually should be able to, it might not come back straight. It might come back like that. That can cause a great deal of pain. Has anybody ever dislocated something? Fun, isn't it? Oh, yeah. Pain like you would not believe. Yes? Knees, shoulders. I was at a tag. It was supposed to be a tag football game, and it was a whole bunch of girls playing. And they were supposed, you know what tag foot, does everybody know what tag football is? There's not supposed to be any contact. You're supposed to just grab a flag. Yeah, well, no. It was quite the violent game. And, oh yeah, they were beasts, I'll tell you. Well, one of the girls made too much contact with her flag, and her entire thumb joint. Yeah. Oh, pain. So what do they have to do? Yeah, and that can also cause a great deal of pain. So dislocations, strains, sprains, just a basic definition. Inflammation, itis, bursitis, tendinitis, arthritis. What's arthritis? It's a general term. What does it refer to? Yeah, joint inflammation, usually associated with what kind of joint? Freely moving joint, synovial joint. So there's osteoarthritis, and again, just a general definition of the different types. Rheumatoid arthritis, which is in an autoimmune category. Gouty arthritis, which is due to a buildup of some, yeah, thank you, uric acid crystals. So uric acid is normally in liquid form, and it floats through your circulatory system, and everybody's happy and fine until it builds up and actually forms crystals. And they're like little needles that jab into your joints. That can be a little bit on the painful side as well. So gouty arthritis. Also Lyme disease. You live in Maine, so you've probably heard of that before. Nasty little bacteria that does what? It's a spirochete bacteria, and it attacks what? It attacks your joints. If you even suspect that you might have Lyme disease, go immediately to your physician and have some drugs administered to you, because it can cause huge problems later on if gone untreated. Okay, so it's a simple regimen of antibiotics. Sometimes they're not so much fun to take because they can cause some other problems like gastrointestinal distress, but much better for you to go on them than suffer the later effects of Lyme disease because it can be very debilitating. Yes? Oh, wait a minute. 2 questions. You first. Yeah, it is. It's terrible. So if you even suspect that you might, even if you get it, to go to the doctor. Yes? I don't know. Don't know about that one. So Lyme disease can cause arthritis, pain, joint pain, because of the nasty little spirochete bacteria that attacks your joints. We're done with chapter 8. Oh, by the way, that's a lovely little what? This is the hip replacement. And this is the what? The knee. So we do the same thing. We take the top off, we put this nice little titanium gadget on and bang it in there. You see the spike here? So this is what, and this is what? This is the femur, and this is the tibia. Okay? So, yeah, that's when all those joints don't fit the way they should. They cross each other. This is an example of some severe rheumatoid arthritis. You can see that on page 272 in your textbook. Okay? So we're done with chapter 8. Want to do some clicker questions? So let's go back. Do you want to do a little from, since we have, 20, 25 minutes to kill, you want to do some questions from all? Huh? When's the quiz due for this chapter? What do you think? 9:25 on Tuesday of next week. All right, let's do a couple questions from each of the tests we're going to have to take. Don't forget to sign the sign-in sheet, my friends. I think you might have already had some of these questions, but it won't kill you to do them again. No, I don't like that question. Here's a good one. Okay, which of the following relationships between a tissue and its general function is not correct? Five, 4. How many people do we have in class today? 3. There's 64 people still registered for this class. Did you know that? Who doesn't have their clicker today? Okay, that's 52. Is that good to have that many people not in class? 5, 4, 3, 2, 1. What's the answer? The answer is A. What should that relationship be? Epithelial cells do what? Protection, support. Well, support.
Like I knew that it was protection, but like in your stomach.
Covering.
Right. Digestion and protect against. So I thought they did have to do it because only in your stomach it can explode. You see what I'm saying?
Yeah, I do see what you're saying. I would probably never ask you that question because what lines all of your digestive tract? It's lining though. and that's where the term comes in. But you're right. What kind of cells line your entire digestive tract? Epithelial cells. So that's, yeah, that's a crappy question. I'm glad you picked that up, though, see? That's the reason I left that crappy question in there. An area, see, I didn't make these questions. The book made these questions. But they're nice sometimes because they make us sort of think about, that's one of the reasons why I don't use test banks and I write my own questions, because they make me think about how you are interpreting the question. An area in the body exposed to external environment would be composed of which of the following tissue types? What'd I do?
Everybody's clicking because they didn't eat it.
Oh. You better know the answer. We already asked this one. 5, 4, 3, 2, 1. Would he lose somebody? What's the answer? The answer is A. Let's see if we got 100%. Woo! Almost. Let's skip, because we did do a couple of these. Let's do this one. All right, the mucus-secreting cells prevalent in simple columnar epithelium are known as five. No. 4. Are you sure? 3, 2, 1. What's the answer? A. Very good. Goblet cells. Mucocells. That's a fake word. Chalice cells. I make up fake words. Well, you must have noticed from my first exam. I should ask a bonus question too, because sometimes I use one of my favorite beverages as a choice. So I should ask at the end of this semester if you know what my favorite beverage is.
Because Susan does that with Luna. She asks us what Luna's breed is for a bonus question
Yep.
at the end of her exam. So what is it?
I don't know. You'll have to figure it out by my exams.
That's not fair.
No, I know.
The end thing.
It's going to be quite obvious. Yeah, it'll be quite obvious. That's all I need to say. I won't ask that as a question. I'll just ask that. Which classification best suits the pancreas? And I think we mentioned this a little bit. Five, 4, 3, 2, 1. What's the answer? Remember we said it was an exocrine and an endocrine gland? Do you know what the difference is? You better for your exam. C is the answer. And it doesn't blow up, so it's not a holocrine gland. Which of the following glands are holocrine glands? And I don't even know if I mentioned this, but we'll see if anybody's reading the book. The book talks about it. And you know it's not the pancreas. Just throwing that out there. 5, 4, 3, 2. Press any button. Guess. What's the answer? Answer is D. What's a sebaceous gland? Oil. What's a salivary gland? Spit. What's well, never mind. The sweat gland, well, actually it's called the sudoriferous gland, but we didn't talk about that yet. So the answer is D. Next exam is multiple choice. The only addition to the exam is what? Essays. And I will give you what? Did I tell you? I didn't tell you? Oh, you'll be so excited. I give you hints. Pay attention to your email because I will give you hints on what the possible essay questions might be. Now, you will notice that I will give you many hints. That doesn't mean all of them are going to be on the test. All of them will be on the test in some way, shape, or form. All of them you need to know. So do not email me and say, which one of these is going to be on the exam? Because I will email you back and say, all of them. Okay? So they're all going to be on the test in some way, shape, or form, but I will pick several of them for you to actually write me out. And do not quote verbatim from the book. Do I do that when I teach you? Do I read from the book? Sometimes I'll quote something verbatim from the book. But when I teach you something, do I just sit there and read the book to you? You would probably poke yourself in the eyes, right? I always say, and again, you're gonna be mad at me for saying this to you. Answer the question. So if you had a classmate that said to you, oh, geez, I don't understand, X, Y, and Z. Think about you then explaining it to them, right? So when you answer an essay question, you should think that way. I'm going to explain this to somebody. And if you read from the book, they would probably poke you in the eyes, right? So don't do that. Understand. Answer the question. As if you had to teach it to somebody else. Okay? So you don't have to make it 75 pages long. You just have to answer the question. Okay, I'm done with tissues. I'm a little bored with the tissues. Let's go on to bone. Any questions on tissues before we go on to bone? Does anybody know who that girl is? I think she's a soccer player. I'm not into the soccer thing, though. Do we know who she is? Nobody knows who she is? Gabby something? Hope Solo. I always wondered who it was. Gabby Reese? Do I have to ask that as an essay? No, I'm kidding. All right, which of the following is not a type of cartilage? Five, 4, 3, 2. What's the answer? The answer is D. Dense, regular what? Connective tissue. Dense, regular cartilage? Nope. So D is the answer. Oopsie. So everybody is clear on, before I start this question, you do not have class on Thursday. You do not have any labs this week, whether you have a Tuesday, Wednesday, or Thursday lab. No labs this week. Go and enjoy yourself. Have a cheeseburger or something. What are you doing Tuesday of next week? A week from today. Exam. What are the chapters your exam is going to be on? 4, 6, 7, and 8. You also have something due before class on Tuesday of next week. Your Chapter 8 quiz, which I will open up when I leave here today. Yes? So just to clarify. Fibrocartilage can be found in which location? Did everybody sign the sign-in sheet? Where's the sign-in sheet? Five, 4, 3, 2, 1. What's the answer? The answer is knee. We saw it, yes? Oh, okay. No 5. What's in the larynx? Hyaline cartilage. Elbow, that's a tough one because they're, yeah, see, that's a crappy question too. You could have picked a little elbow, but knee is where we're going to find that fibrocartilage. Elastic cartilage in the ear, yes? Growth of cartilage from within cartilage is termed what? A possible good essay question. Again, if you had no idea, look at the words. Okay? Think about the words. Something in the word is going to give the answer away. That's my hint to you. 5, 4, 3, 2. What is the answer? The answer is not A. Oops, what did I do? Wait a minute. Sorry, I'm getting all confused. The answer is A. I know. What word? Within. The terms long, short, flat, and irregular are used to classify bones based on what? Five, 4, 3, 2, 1. The answer. The answer is C, shape. Most important characteristic for designating a bone as a long bone is That's a crappy question, too. 5, 4, 3, 2, 1. What's the answer? The answer is A. But see, I would put something like it's longer than it is wide. I don't like that question. Do you like it? Which of the following functions of the skeleton or skeletal system would be considered a metabolic function? What's metabolism? What's that word mean? The chemistry that takes place in our bodies. Metabolism. There's my hint. So I'm asking you about metabolic function. 5, 4, 3, 2, what's the answer? The answer is C. Minerals for what? We're going to study this next chapter. I don't know if any of you are eager beavers and read ahead, but calcium, which is one of the main components of bone matrix, is extremely important for what metabolic function? Chapter 9. Important for nervous system too, but what's chapter 9? Muscles. Muscle what? Contraction. Okay, so we're going to talk a lot about calcium and its role in muscle contraction. All right, let's go on and do a couple questions from, oh, what am I doing? Let's go do chapter 7 questions. I don't know, I hope I have, do I not have clicker questions? Oh yeah, there they are. No, it's not. How many bones make up the skull? And this one should be an easy one. Okay? And yeah? Because we know it's not. Definitely not. And we know that's way. 5, 4, 3, 2. What's the answer? What do you think the answer is? You have no idea. What do you think the answer is? It's 22. How many bones do you have in your whole entire body? 206. So there's not just 6 bones in the rest of your body and 200 in your head. And you know it's not just one because we described a whole bunch of them, right? And you don't even have 220 bones in your body, so you know. You see what I'm saying? So I'm safe to assume, even though I don't know, what's the answer? The second one, which is B. Yes? Thank you. Could have started from the bottom. The blank is not an integral bone of the skull and is not attached by sutures to the remainder of the skull bones. Five, 4, 3, 2, 1. What's the answer? D. Very good. The skull bone is connected to the rest of the cranium posteriorly via the coronal suture. It is which bone? So remember, you have to know your sutures, right? So put your fingers where your coronal suture is. Now ask yourself the question. This skull bone is connected to the rest of the cranium posteriorly via the coronal suture. 5, 4, 3, 2, 1. You're all touching your, where's the coronal suture? Show me. It's your beautiful crown. That suture is posterior to what bone? Oh, frontal. Yes? Because I saw everyone's like, yes, parietal. Is that posterior to your parietal bones? It's what? It's anterior. Ooh, that was a tricky question. I like that question. Because that was nasty. That was, boy, they're giving me a hard time. I'm going to put a nasty one in the question right there. So, this bone contains 4 major areas: squamous, tympanic, mastoid, and petrous. It is the what bone? One of those things should stick out to you because I pointed it out when I was talking about this bone. Five, 4, 3, 2, 1. What's the answer? The temporal bone. Remember the mastoid process I pointed out? All right, let's go do a couple questions. I don't think I have any clicker questions for chapter 8. Oh, they're there. Do a couple from there, and then you're out of here. Make sure you sign the sign-in sheet. The site where 2 or more bones meet is called what? Five, 4, 3, 2, 1 and a half. Answer. The answer is D, articulation. Very good. Which of the following correctly lists 3 structural types of joints? Structure. Five, 4, 3, 2, 1. What's the answer? The answer is C. Not function, structure. Yep, not movement, structure. Yes? An amphiarthrotic joint exhibits which level of movement? Five, 4, 3, 2, 1. What's the answer? The answer is B. Okay, guys, make sure you sign the sign-in sheet. Make sure I get it. Have a great little October break. And don't not be here on Tuesday unless you are in the hospital. Yes?